Appreciate you guys. Just got a couple little bills here today. Everybody's interested in. Appreciate it.
Good morning.
Senator, if you want to come on up and get ready. We are just not going to have enough time. I can just tell you. We're, go ahead and take the roll.
All right, good morning. Representative Bear,
Here.
Representative Byron,
Here.
Representative Locke,
Present.
Representative Northrup,
Here.
Representative Oakley. Here. Representative Storer. Here. Representative Strock.
Here.
Representative Zwanitzer,
Here.
Chairman Harshman.
Here.
Thank you.
Good morning. Thank you. How many folks here in the audience drove here from somewhere? I mean, over 50 miles. Okay, we all know what's going on with the weather. So we've got two bills that I think people are really interested in. And this first one, 151. And I put on the committee announcement that the next one, 101, as time allows. So here's what I'd really like to get done today. I mean, we could talk all day probably on this one first bill. But I'd like to have us try to finish up by about 9:30 at the latest. So the next bill I can at least hear, how many people on 101, the second bill, drove from out of town? Okay, we got one for sure. So I want to hear from people that came from out of town for sure on that bill. So we'll just see, but might go faster than what I think it will, but we'll see. But so anyway, appreciate it. If 101 we don't get to work, and we'll carry that over the first bill on Thursday. So that's the plan on that. Okay, very good. So we appreciate you all being here, and this is our normal room. Should have probably got a little bigger room, but looks like everybody's got a seat. Appreciate you all. If this is your first time ever at a legislative meeting, we always work our discussion through the chair, so it's never between, or, you know, those kind of conversations. And it's Wyoming. It's all good. So even the bad stuff's good. So good morning, Senator Hudson. Thanks for bringing your bill, and we're glad to hear it. So take us through your bill and your introduction. Thank you.
Thank you, Mr. Chair. And with you, I'd like to try to get this going, let it run smoothly, decently, and in order. You're probably wondering how a retired military system analyst got hooked up with two pharmacists, or three or four or five, several of them. I was in a committee room like this, and we were going over the pharmacy benefit manager bill a couple interims ago. And I thought, wow, this subject is really over my head. It really is. And I remember a PBM sitting down and discussing, giving her testimony. And I looked at that PBM and I said, it sounds to me like you're scamming the government. And they looked back at me and said, everybody scams the government. And that's what set me off. And I said, I'm going to try to help these people as best I can. I guess this has been going on for quite some time. I'm going to introduce these two to you. This is a Doctor of Pharmacy, Scott Schmidt, and Doctor of Pharmacy, Melinda Carroll. They're going to help me run this bill because there are little pieces that I can't do on my own. So with that, I think the first thing we can do is allow the doctor to tell you what a PBM is really quickly, and then I'll go over my spiel and go over the bill and allow them to talk as well, if that's okay with you, Mr. Chair. Thank you.
Mr. Chairman, committee members, Melinda Carroll with the Wyoming Pharmacy Association, and I am a practicing pharmacist as well. I do practice here in Cheyenne. Yes. Yes, I am. So with that, a PBM, or a prescription benefit manager, is a company that a health plan contracts with to administer their prescription drug plan. They then contract with drug manufacturers and pharmacies to create formularies and to create reimbursement for the pharmacies. They also are contracted with that health plan. So multifaceted, very much a middleman to the drug supply chain. It does get very confusing. That is a very 10,000-foot overview of what a PBM is.
Okay. All right. Well, during our Senate testimony, Mr. Chair, I had two people stand up and support the bill. And I loved what they said so much. I kind of wrote it down and said, I'm going to share it with you so I could do this in haste and hopefully give you guys a good understanding. What savings does the state think or an employee or you and I getting with our insurance, our pharmacies? We really don't know. Senate File 151 brings out that we need some transparency to see if we're getting the bargains we all think we're getting or not. This bill does not cut out the PBM, but it cuts out the most abusive practices and requires transparency so you can see whether you're getting a savings or not. The fiscal note has been remedied by adding a sentence on page 4, lines 2 through 3, and we'll go through that a little later. The state has a coupon program. The PBM says that they'll negotiate with the state and they'll pass the savings along to the state. The state gets the coupons that add up to about $2.5 million. What we don't know is what the PBM is keeping. We also do not know if we're actually getting the best deal. On top of that, they do not have the incentive to prescribe that drug or something less expensive. We don't know because we cannot audit these transactions. 36 other states have said there needs to be more transparency. You'll see that on this big sheet here. It just kind of goes over what NCPA, which is the National Community Pharmacy Association, the 10 phases that most states are going through trying to pass legislation to reform PBM activities. And you'll see the states along the sides in gray, and you'll see Wyoming down there at the bottom, and see that we've passed 4 of the 10 phases in legislation. These transparency laws do not increase drug costs, and you'll see that later. PBMs also withhold information, i.e. drugs on current formulary prices. They will reimburse unnecessary fees, decrease in patient choice, spread pricing, equality of reimbursement. You really don't have any idea, again, whether you're getting a bargain or not. The savings the PBMs are passing along to you cannot even be verified. This bill makes all the sense in the world. It does not cut out the PBM, does not raise costs unless the PBM wants it to. It does not take money away from hospitals or employers. It just asks the PBM to stop their most abusive practices and be transparent so the patients, doctors, pharmacists know what they're truly getting, whether it's a benefit or not. PBMs have what's called impacted information. That is, if you're in a contract with someone who knows more than you do, you're pretty much losing. This is what happens with the PBMs. Summing this all up, the PBMs are so profitable. One is so profitable, they went out and bought their own insurance company. You'll see that in the vertical integration charts I handed out to you on your desk. I gave you what I called supplemental information. If I can show you what that is, so you can look at that. It looks like this. And these guys will explain that a little more. This was on your desk. Okay. All right. So, 2 insurance companies bought PBMs. They have all merged into oligopoly. 3 PBMs control almost 80% of the market. They are either owned by or own their own insurance companies. Ordinarily, you would think that an insurance companies would ride herd on them. But you see the conflict of interest. The incentive is just not there. Clawbacks, which you'll see in the bill, are where pharmacists get paid for the drugs they dispense. You think it is according to contract. 2 months later, for example, they contact you and say that we recalculated that reimbursement and we paid you too much. We want the money back. Those checks can be fairly big. The pharmacist says, we need information about this, but the PBM will not give it to them. They are told they do not have the right to have that information and they want their money back. Another senator across the aisle was very instrumental in getting this out of the Senate. He says PBMs are working in their own interest. Working in the patient's interest is their secondary priority. We do not know how much money they are keeping relative to paying out and providing services. Without this legislation, we do not know if we're being fleeced, when, where, or how. Hopefully, we'll see this type of legislation get through and be able to rein in the costs of pharmaceuticals in Wyoming and stop the abusive practices that go along with them. With that, I don't know if you guys have anything else to add before we get started on the bill. Right. We'll do that as we go along, sir, and I thank you for that. The bill is fairly simple, straightforward. And on page 1, it just tells you what the act is. On page 2, we go over transparency prohibitions. These are the business practices that the PBMs, let me see, business practices that PBMs often utilize against community pharmacies. These business practices increase costs for pharmacies, decrease patient access to healthcare, and increase healthcare spending and for patients and employers. That is the section, page 2, line 7 through 23. And if you guys have anything, if you want, just jump in. We ask that the pharmacy benefit manager shall not do certain things, cause or knowingly permit the use of an advertisement, promotion, solicitation, representation, proposal, or offer that is untrue, deceptive, or misleading, and or change a pharmacist or pharmacy provider, a pharmacist or pharmacy provider a fee for any of the following: a submission of a claim, enrollment or participating in retail pharmacy networks, the development or management of claims, an application or apply for network access with pharmacy benefit managers, credentialing or re-credentialing, any change in ownership, and retroactively deny or reduce reimbursement for covered pharmacy services, to name a few. I won't go over all of them because I'm sure you've read it. And then on page 2, section 1, we talked about the deceptive communications, the unnecessary fees. On page 3, on page 4, just to speed it up a little bit, we have increased patient choice. And if you go to the top line on page 4, lines 1 through 3, this is where we remedied the fiscal note by just adding in on line 2, except for specialty medications as defined, we took out the 2.5 million for 2004, 2.7 for 2005, and 2.5 for 2006. That was a Senate amendment. We've only had one. And then we talk about spread pricing on the prohibition against spread pricing in section 5. Spread pricing is when the PBM charges a plan sponsor or employer, for instance, $75 for a prescription, while only reimbursing the pharmacy $25 for the prescription, keeping the remaining $50 for themselves. Spread pricing increases costs to the patient and employer. Let me see, prohibiting on line 20, a pharmacy benefit manager services administrative organization contracting agency or agent of a pharmacy from sharing upon request copies of the pharmacy benefit manager contract. And you'll hear more about that later. Page 5, equal reimbursement in section 1. Let me see, that's on page line 11. This provision prohibits the PBM from reimbursing a PBM owned or PBM affiliated pharmacy more than the PBM reimburses a non-PBM owned or affiliated pharmacy for the same services. And then we have on page 5, ensuring access to local health care. Let me see. That would be on line 20. A person's choice of network provider shall include retail pharmacies. And we'll move forward. There's something called patient steering where the PBM steers a patient to the PBM's pharmacy to have and prohibits a patient from filling a prescription at the pharmacy that they choose to. They also, let me see, on page 6, we're creating a new section 2652-106, alternative reimbursement methodologies. This requires that all PBM networks contracts include a reimbursement appeals process for both brand name and generic medications when the pharmacy is reimbursed less than the pharmacy acquisition cost. All pills shall include the same requirement as 2652-104 through D through 2652-104M. And I know this is, I don't know if it makes a lot of sense to you just having come on as the revenue committee reading this, but this is a really simple bill. Be transparent. Don't perform egregious activities with the pharmacies. And then on page 7, you have definitions. And you'll also see a sheet there where we have a proposed amendment for your committee on lines 11 through 15. It seems like we did forget to add the workman's comp exemption in there. And you can read that. They wanted that amendment put into the pharmacy benefit manager definition. And I don't really know exactly where it should go. I'm sure the lawyers can tell us where that is, but that is one amendment we'd like you to propose, look at, and hopefully pass during this committee meeting. So like I said, the rest of it is definitions, pretty self-explanatory. Then we go to page 13, section 3, where the Department of Insurance would like another employee. He's going to take that from his own special revenue. That too was an amendment in the Senate where we changed it from the general file to special revenue. And I might have missed, there was one place on page 10, excuse me, where we amended in an exclusion of Medicare and Medicaid, and that was it. The bill, like I say, is pretty clean coming to you and straightforward. I don't know if I explained it as best I could, but I think with the pharmacists here, they can answer any questions that you may have on anything I may have said.
Any questions, for the trio up here? Okay, very good. Appreciate you. We're gonna open this up to public comment.
And
Total
Mr.
work.
Chairman, if you don't mind, it was just brought to my attention, like maybe 2 minutes before I came in here, that someone has brought a, where is it? Brought a substitute bill. And that surprises me
Well, that'd be
because,
during the amendment process.
right,
So,
but it just
we'll talk
surprises
about
me that that was brought about. And I just found out 2 minutes
Yeah.
before this meeting. I always, Mr. Chair, when I'm gonna amend someone's bill, either side, I go to the sponsor of the bill and let them know what I'm planning to do. So
okay,
I'm just gonna let you know, I find it very rude and disrespectful not to come to me, especially with a 3-day weekend, to let me know that there was something
okay, I'm gonna cut you.
amiss.
I think we got it. Okay, but
Thank
we're
you,
gonna
sir.
work the bill, so we don't want to run out of time. So
I
we
got
have to
you,
keep-
and I hope you
A
work.
lot of people here want to talk on this bill.
Gotcha.
So I'd like to, we're gonna start this. So here's what we got. So it's 8:25. I'd like to go, why don't we go 25 minutes for those who are opposed to this bill? Okay, and you can just line up, one person can talk for 25 minutes, or 25 people can talk for a minute.
Gotcha.
Okay, so let's go. Those who are opposed to this bill, come on up. We want to hear about it. And you can just fill all 3 seats. I'm going to get my timer on 25 minutes. And,
We're giving some of the agencies time to talk about. it.
and actually, you know what? Let me back up a little bit. I'm getting ahead of myself. Are there agencies here? Other elected officials that want to talk? Come on up. We got to hear from the insurance department. Now, if you're a co-sponsor of the bill, you don't need to sell the bill to us, but if you're an agency or you're the elected treasurer, those kind of things, you bet. You want to add to it. I want to first hear from Mr. Hayes here with the insurance department. Go ahead.
Mr. Chairman, members of the committee, my name is Ralph Hayes. I'm the manager of the Employees and Officials Group Insurance Program. I'm here to speak about the fiscal impact on this particular piece of legislation. I want to give you a little bit about my background, just so you understand where I'm coming from. Before coming with the state, I spent 20 years in the health insurance field. So I actually come from the insurance side. I've been the manager of this program for 21 years. I earned a professional designation of a certified health consultant. I'm used to seeing numbers. I understand the actuarial process. So when we deal with these numbers that I'm talking about, you understand that I do have a general background and to create these. Now, I know that was mentioned, we had the original fiscal impact, which was 2.2 million in 2024, 2025 was 2.6 roughly, 2026, 2.7. This is for the coupon program. Unfortunately, the amendment to the legislation did not touch this at all. The amendment was strictly towards the sole source medications, and sole source medications can only be gotten in one location. We never received any coupon revenue from those particular areas. So what the coupon program does is when we run through the PBM's pharmacy, they base, and we know exactly what it is because we go out for RFP, we put everything in the contract. We are transparent. We pay a flat fee, so there's no spread pricing in our contract, but we put these things down. And on this coupon program, it's required to go through the pharmacy at the PBM so they can coordinate everything. Basically, they track it. We get the credit for the coupon programs. The employee gets a part of it, but the employer gets a much larger share of that, which lowers our premium, this is what this is addressing right here. And roughly, it was a study I found, it was very difficult to find, and I'm trying to re-find it. But roughly, if you take away the mandatory mail order for specialty medications, between 75 and 85% of the people are going to start filling that medication locally, which wipes out this coupon program. And by the way, the PBM does keep a piece of this, 25%. So this is the amount that we receive, and we do know what it is. And we do have the ability to audit PBMs. We have in the past to make sure they're following the terms of the contract. Now, there are some additional, with amendments, additional fiscal impacts that are coming aboard. Now, there is the ability to use AWP, which is a price point that's identified in the legislation as a pricing point to do appeals on. When you do the appeals process that was put in by amendment on the Senate side, it allows basically pharmacies to go around the contract language and get additional reimbursement for both dispensing fees and for, of course, the price of the drugs. Now, with average wholesale price on there, that's not really a number. I mean, it's heavily inflated. Now, I did ask my pharmacy, PBM, excuse me, to provide me with a benchmark point on how much, if you paid everything by AWP as the price point, what would that add to the fiscal impact? It was $38.7 million. Now, I don't believe that's the amount that was going out there, but I'm showing you what a worst case scenario is when you use AWP as a price point. Now, with the ability to go through the appeals process through the insurance department and get claims readjusted both for, again, dispensing fees and for the potentially average wholesale price, I have an additional impact on the wholesale price of 7.5 million in 2024, and it goes up after that. And for the dispensing fees, almost a little over $1 million. And that's just on, again, the ability to go around the contract to the appeals process. So I do have concerns out there that a lot of people don't really understand how this works, and I do, that this does have a fiscal impact to the state. Now, I will point out, I did some additional research just to kind of give an idea, because everybody throws around these billions of dollars as far as these mass profits and things like this that are supposedly out there. And I want to give you some of the, and this comes out of macro trends right off the internet. So it's basically the earnings of these organizations over the last one. And these are the organizations that actually have a pharmacy in Wyoming. So Walgreens, 3.2% margin. Walmart, 2.36% margin. Albertsons, 2.27%. Kroger, 1.69%. And CVS Health, which is our PBM, who's also a pharmacies, 1.29%. So I have to question, where are these billions of dollars and all these mass profits coming from that I've been hearing about when I go to the public information, through their own financial reports on a quarterly basis. And these were from third quarter of last year. Anybody can go out and look it up. However, I will talk about the prescription drugs. Pfizer, 29.8% net profit margin. Johnson & Johnson, 19.9%. Merck, 25.8%. AbbVie, 23.1%. Eli Lilly, 20.6%. So where's the real profits being made? It's in the manufacturers. And quite frankly, we receive 100% of the rebates through our program, and we do it through a restrictive formulary. It's worth $20 million. Who's paying those? The manufacturers, because the PBMs have negotiated those rebates, and we get 100% pass through. Now, most of the rebates these days really aren't being kept by the PBMs. Insurance companies like the Cignas and Blues and et cetera, they have negotiated to where they're receiving this, or large groups like us, where we get 100% of the rebates and we get reports on what's billed and what we receive. So, there is more transparency than you think out there, but you need to be a client looking at your own particular information. And Mr. Chairman, if you have any questions, I'd be happy to answer them.
Thank you, Mr. Chairman. Mr. Hayes, I've heard what you stated, but I'd like your opinion about some of the information that I'm receiving from NCPA, where states who have passed these types of transparency bills actually end up with savings. Their costs are below that of the national average. What's your opinion of that information?
Mr. Chairman, members of the committee, everything about this is increasing revenue to the pharmacies. I see nothing in this particular piece of legislation that is actually going to lower the cost, and that's based upon my 40 years in the industry. So what I see, I don't know what those studies are based upon. I do know of one study that happened where legislation was passed. It happened during COVID, and they looked at strictly the premiums, and did they go up? No, but our premiums actually went down. Our pharmacy side kept going up, but our medical side, because people weren't going to their doctors, went down. And the offset basically showed no increase in premium. So if they were based upon a study like that, COVID really was a large cause of that. And I do want to point out one other thing. When we look at our particular plan, we are looking out for the independent pharmacies, which is roughly 40 some in this state. However, only about 11%, 10.8% of our spend is with the local independent pharmacies. The rest of it is with chain pharmacies and, of course, our mail order pharmacy through CVS. So this particular piece of legislation, when I went out for RFP last time, we understanding that the independents, are struggling. And, that PBM, I think, is maybe a part of it, but I think a larger part of it, quite frankly, is the chain pharmacies who are competing against them. But we increased our dispensing fee by 50% by choice to help our independent pharmacies. But I really don't want to do that. That was on the 11%. I didn't want to extend that same thing to the chain pharmacies. As you see, their profit margins were better than CVS. Why do I want to increase their profit margins? So I'm focused on what we can do for the independent pharmacies, not the chain pharmacies where the majority of our spend is.
Thank you, Chairman Harshman. So my question would be, when was the last time they would have given pharmacies a cost of living raise? And, I know they're not helping them with even the labels and the little jars and everything that is coming out of the pharmacy's pocket. When was the last time PBMs helped with that?
Mr.
Mr.
Chairman,
Hayes.
members of the committee, one thing I will let you know that, the independent pharmacies are generally not negotiating directly with the PBMs. They're pharmacy PSAOs, Pharmacy Service Administration Organizations. They're the ones who are really doing the negotiations. And I can't really tell you what those negotiations look like. But it was mentioned, everybody's in it for themselves. Well, I would say pharmacies are in it for themselves. They want to increase their profits. PSAOs want to increase their market share, and they do that through their contracts with the independent pharmacies, and everything's funneled through their particular PSAO and their wholesaler. So there's a lot of self-serving interest with each one of these organizations trying to hold down costs, trying to maximize their own profit revenues. But again, I know our own pharmacy, when I looked at that quarterly report from last year online, which anybody can look up, not a very big net profit margin.
Thank you, Chairman Harshman. So another question that I learned through all of this was that if you say if I didn't come pick up my prescription on time, there was a big fine that got put on the pharmacies. And they got that fine if it was still sitting there for a few weeks. Could you explain how that works? And I had learned that the fine came from the PBMs. Would you mind sharing?
Mr. Chairman, members of the committee, I cannot answer that question because I'm not privy to the actual contract negotiations between the PSAOs, which is the independent pharmacies, and the PBMs.
Chairman Harshman, thank you for the opportunity to be here, and members of the committee. It's a privilege as well. My name is John Conrad. I'm the representative for House District 19. And I want to share with you some of my thoughts as it relates to Senate File 151. Specifically, this Drug Transparency Act, from my perspective, is an exercise that amounts to really a bait and switch pricing tactic with our consumers. It would truly interfere with how our insurers and businesses, specifically in the Southwest area, design their health plans and would ultimately raise our prescription costs and health insurance premiums. This bill would make prescription drugs, health insurance more expensive, placing our health of our Wyoming citizens at risk. We've talked a lot about money, billions, millions, et cetera. I want to bring this back home. I want to bring this back to the state of Wyoming. If this bill were successful, the additional costs that this would relate to a specific employee is between $23 to $36 per employee per month. And when we think about that, the rising cost of eggs, diesel, whatever, $23 to $36 per employee per month. This bill would also, with a loss of coupons, the employee would have to pay full prices for specialty and newer drugs under patent. If the accumulator is removed, Wyoming employees would have no way to ensure that the employee meets their out-of-pocket expenses before the company bears that full cost. Additionally, the customized tiering list that the Wyoming employers have enacted would go away, as well as employees will be paying potentially higher costs on prescriptions. And this custom tiering is for strictly higher drug uses, including preventatives. This bill removes the ability for employers to control their prescription drug costs with health plan benefit designs and prohibits the PBMs from applying cost-saving tools supporting our health plan benefit designs, as was mentioned earlier. I'll close with this to allow other folks to speak. There's a lack of clarity within this bill on the definition of dispensing fees. Additionally, the definition of specialty medication keeps changing, and depending upon the bill or where it lands, it could handcuff our citizens' ability to manage their very expensive drug therapies. There are prohibitions for directing patients to lower cost pharmacy locations. And finally, the language creates questions on how rebates and medication assistance funds are distributed to self-funded groups. And claim costs would likely increase administrative costs. I would urge you, through the testimony you hear today, to see through this bill as something similar to a Peter to pay Paul, and understand the detriment that it will place upon our vital workforce in this state of Wyoming and negatively impact it will cause. Thank you, Mr. Chairman.
Okay, any questions for Representative Conrad? Okay, thank you for being here. Representative Banks, morning.
Thank you, Mr. Chairman. Good morning. I'll just be brief. I'm here to speak on behalf of the rural pharmacies in the state of Wyoming. We've heard a lot about the benefits to corporations, and if we continue on the route that we continue without this legislation, what we're going to see is a consolidation into large corporations into the hands of a few at the expense of our rural pharmacies. And I don't think that it should be the policy of the state of Wyoming to push our small pharmacies out of business. What we're asking for in this bill is transparency so that we don't have those consolidations, because if we have a monopoly of control over the cost, then we are going to see the cost increase. There's been these false accusations about the overwhelming cost to the state. That's a narrative to distract from the fraud that's taking place. If we continue to see, and we've heard testimony, other states have enacted legislation similar to this, which has brought savings to the state, not cost increases. If we are to have transparency so the books can see, so we can see the books and open these costs and availabilities, we will see just how truly our rural pharmacies are suffering. And a note about transparency. When you fight transparency, then there might be some shady things going on that are determined we don't want to uncover. So I encourage the passage of this bill so we can open the book, so we can see truly how our rural pharmacies are hurting, so we can keep the power from coming into the hands of a few major corporations who will skyrocket the cost to not only our consumers, but our small town pharmacies as well. I'm here for them, for the rural pharmacies. And I want to just say that in my area, if we lose our local pharmacies, it's a 70-mile drive to CVS, which is where we're trying to be pushed to buy our medications. And so 100% rebates for CVS, as we heard, and big pharma, that's not the case with rural pharmacies. Those 100% rebates are not taking place from testimony I've heard around the rural pharmacies in my area. So I encourage the passage of this bill so that we can open the books. Let's just open them and see, and keep our rural keep our rural pharmacies open, and let's just have some transparency, because we don't want the policy of this state to be putting these very important things such as medications and policies into the hands of a few big corporations. Thank you, Mr. Chairman.
Questions for Representative Banks? Okay, now, I'll just tell you, I've heard the word fraud a couple times, and I just think we want to be really careful. You know, that's a pretty serious thing, and we're not here to make any allegations, so just everybody tone it down just a bit. And yeah, it's not a deal, that's not that's a crime, and we're not talking about people doing crimes here. So let's just everybody back off a little bit. Okay, now, since our electeds burned some time there, we are now, are you a state agency? Yeah, you gotta go. We're good. You go. We're here.
Measures that are a path.
Okay, go ahead and introduce yourself again for the record.
Jeff Root, I'm the Wyoming Department Commissioner of Insurance. We're neutral on the bill. We were neutral on the original 151. We're neutral on the version that is now before you with amendments. And we were neutral on the one bill we tried to get the parties together over the interim and come to an agreement upon, which we moderated. And we came very, very close to getting something done, but we're not here there with that bill today. I'll just say that PBM regulation is very difficult. It's like when you're walking towards a very distant mountain, the longer you walk, the further it seems to be away from you. And that's sort of how the understanding is for this. We have no one in our office that understands the complexities and the nuances of PBM regulation. It is tough stuff. It just is. We came up with a fiscal note based on the original 151. I have no doubt that we cannot do what's required of regulatory matters in this on this bill. And that's why we're asking for a person, and I'm going to have to bring in outside people who will train them. This is what other states have done. It's just, if we're going to go further in the regulatory arena, we're going to have to pay for it, and we're going to have to do it professionally and knowledgeable. There is one area, there's one thing I want to clarify that I think it's on the bill, on page 10, lines 4 to 6. The phrase is used, or any other health benefit program or coverage maintained by the federal government. And as a regulatory body, I think we need clarity on that, because I think the intent is clear that we want to exclude Medicaid and Medicare. But when you look at other federal coverages maintained by other federal government, I'm not sure what that is. I think it probably means VA. It probably means TRICARE. Does it mean the Affordable Care Act plans? They're set by the government. The federal government sets the plans. They said it has to cover this. They set pricing because the insurers have to pay a set amount. And if not, if they don't pay enough in claims, they have to rebate. So whatever the body wants, I just need to know what the intent is if we're going to be required to regulate it, because to me, that was unclear. I really just want to be here if there are any questions about what we're asking for in the appropriations. If there are any questions about the other bills or anything like that, I'd be happy to answer them.
Okay, Ms. Root, thanks for being here. Questions?
Can I do one real quick, Mr. Chairman? On page 13 and 14, the Good Friends Down the Hall amended your transfer of funds from the general fund to special revenue. Well, I guess I'll just ask it. Do you think it's fair to make our insurers have to pay for these costs instead of it coming from the general fund?
ahead,
Mr. Chairman, Representative Swanser, this is how we fund our budget. We know all the insurers that have a license to do business in Wyoming. It's 1,200. We take our budget and we do basic division and we send them an assessment, and that's what they do. We have insurers that pay an assessment, and part of that money goes to people that look at service contracts for refrigerators. Not exactly insurance, but it's under our bailiwick. It's what we do. It's certainly up to the committee. Now, other states that have more expansive PBM regulations, they're talking significant appropriations for the expertise in the departments of insurance. Tennessee, I have a copy of the fiscal note. Tennessee just did a broad sweeping a bill. Over 5 years, the appropriation is 23 million from the state with 23 people to create a PBM division. I have 26 people in my entire office. We're gonna have a division that's almost as big as my office. And so the more regulation grows, the more we're gonna need experts to do this. And if we can't do it in-house, I at least need one person who's qualified to, handle the little ones and work with the vendors on the big ones and farm them out. And so with that,
Okay. Any other questions, Mr. Root? Okay, thank you for being here. Appreciate you. Okay. Good morning. Gotcha. Okay.
State agency.
Please introduce
Yeah.
yourself.
Good morning, Mr. Chairman, members of the committee. My name is Corey Cooper. I'm the pharmacy program manager for Wyoming Medicaid. And I'm here this morning because our friends in the Senate made a nice exception for us in the bill at our request. And just to explain a little bit why we asked for that, Medicaid is a state federal partnership, of course, and we're governed by federal regulations, and some of the federal regulations that we need to comply with conflict with language in this bill, specifically the audit and the pricing. Our reimbursement for pharmacies is agreed with the federal government, and so we can't change that because of state legislation. So we asked for an exception for Medicaid. And the Senate was kind enough to amend the bill to exclude us. However, the amendment ended up in the definition of spread pricing. And so our exception ended up on page 10 in the definition of spread pricing. So now it says the pharmacy benefit manager charges a health benefit plan, not including Medicare, Medicaid, or any other health benefit program or coverage maintained by the federal government. I would suggest that the proper place for the exception for Medicaid is actually on page 8 in the definition of Romanet 7 in the definition of pharmacy benefit manager. And we would ask that, well, I guess I just want on the record, I am only here to speak for Medicaid, not Medicare or other federally funded health programs. So if that language is problematic to the committee for any reason, including those other programs, I'm only here to speak on behalf of Medicaid.
So that was, we had this on workers' comp as well, kind of in
Correct.
that same area. Maybe we can put some A and B under there and take care of that. So very good.
That would be great.
Questions?
Stand for question.
Okay, Dr. Coop, appreciate you being here. this
Thank
morning.
you.
Thank you for your testimony. Any other state agencies impacted folks on this? Please come forward. Yeah.
Mr. Chairman, Jason Wolf, Administrator with the Department of Workforce Services. I oversee the workers' comp program, and I'm just available for any questions. I know you guys have the amendment that we worked with Senator Hutchings on, but would stand for any questions, Mr. Chairman.
Okay. The amendment, of course, was important. You brought it to us. Any other comments on the bill, your costs, those kind of things?
Mr. Chairman, I think workers' comp is a bit unique
Right.
in the respect that we pay by an AWP model that is promulgated in our rules. And this language in this bill would kind of upset that and make us pay by a different methodology, which I could decrease the cost actually to the independent pharmacies because the AWP pays different than the other average wholesale or average price. So, which I'm not an expert in, so.
For state agencies, electeds, I think okay, now it's 8:52, so let's go 20 minutes for those opposed to the bill. Just start filling the seats. Those opposed to the bill, come up and we'll just go one at a time, and I'm gonna start the clock. I'm gonna start right now, 20 minutes.
Good morning, Mr. Chairman, Mr. Chairman and members of the committee. My name is Heather Roday and I represent Blue Cross Blue Shield of Wyoming, and I'm joined by Raymond Red Jr., our general counsel. We are an independent, not-for-profit company based in Wyoming for over 75 years, and we are licensed to provide health insurance only in Wyoming. We make operating decisions locally and don't report to shareholders, and any excess funds are put back into the business to ensure payment of future claims. We cover 125,000 members plus 85,000 members through national agreements. And we perform two basic functions in this discussion of health insurance. We provide fully insured health insurance, and we provide third-party claims administration for self-funded businesses. Here's what that means. Fully insured members and businesses pay us premiums to make sure when health events happen, we're there to cover their healthcare services. We assume the risk and must set many of these premiums close to a year in advance and estimating what costs will be for all healthcare services. Our self-funded clients, who are key Wyoming companies, pay the cost for every claim themselves. They access our networks for reduced rates and cost-saving measures so they can provide health insurance to their employees. Prescription drugs are a very large part of our total expenditures. There are drugs with manufacturers set prices in the millions of dollars. Other common drugs used by many members are in the $20,000 to $100,000 range per person, per drug, per year. And all of that adds up to real money. We contract with Prime Therapeutics, a pharmacy benefit manager owned by several not-for-profit Blues plans. Our ownership of Prime is less than 1/2%. Prime does not answer to shareholders. They provide value to each plan by managing prescription plans for the value of all of their owned members. You've heard critical statements about PBM business practices. I've been told this legislation is needed. Prime and Blue Cross Blue Shield Wyoming don't utilize the practices mentioned in other sites' narrative, and we're happy to discuss the specifics at any time. So about this bill, our members and business clients rely on us to push back when we see cost drivers in legislation such as Senate File 151. These partners agree with our opposition, as shown by the letters you received, signed by associations and 67 of our business partners. These signatures represent tens of thousands of Wyoming citizens. This bill draft isn't about transparency. It raises costs with non-transparent, unclear language, making it deliberately difficult to understand what the true consequences will be. Additionally, acquisition costs and dispensing fees have no limits, making it impossible to control costs. You heard earlier about the inability to have our employers be able to execute their plan designs for specialty drugs. This is also the case for higher cost maintenance drugs like diabetic treatments. We would agree with what Mr. Hayes said earlier about the concerns with MAC pricing and the ability through appeals to avoid contracts. For our impacts with that, our costs could grow 2 to 3 times as a worst case scenario. This bill is championed by rural independent pharmacies, but it isn't limited just to them. 70% of our prescriptions are filled at big box chain stores, so Wyoming members will be paying more to support large national chains over rural independent pharmacies. So as a reminder, we were directed by the 2022 Corporations Committee to have over 20 hours of discussions in the interim between rural independent pharmacists, pharmacy advocates, and PBM industry stakeholders. The question was asked if a bill could be limited to independent pharmacists, and the answer was no. Even so, concessions were made and transparency language impacting all pharmacies was agreed to by both sides with no cost escalations. After the language was submitted for bill drafting, the rural independent pharmacists and pharmacy advocates unfortunately withdrew support from the draft and brought forth 2 bills, both with increased cost implications. We now have this bill, which is state government directing activities in the private market. It circumvents private contracts by directing private sector insurers and employers to subsidize different private sector businesses, pharmacies. And this feels an awful lot like government taxing citizens and business for the benefit of all pharmacies. We estimate this bill will cost our company and employer clients at least an additional $31 million every year on top of price increases from drug manufacturers. And when healthcare costs rise, we must pass them on to our members and our clients. So Wyoming commercially insured members already pay some of the highest premiums and healthcare costs in the country. We ask you not to use state government to inflict even higher costs to tax insured members of the healthcare they need. Please vote no on Senate File 151. Thank you, and we stand for questions.
Any questions from Ms. Roday? Okay, thank you for being here. Testimony. Anyone else? Go ahead, Mr. Reed. We'll just work down the line, and if you want to give your seat up, if there's anyone else can take that seat, be great. Go ahead.
Mr. Chairman, I'm simply here to support Heather, but I stand for questions if there are any. I think what I would say is just that we did work with the independent pharmacists, with the pharmacists over the interim, and this bill is not what we agreed to. There is a lack of transparency in this bill itself with respect to the pharmacies. There's a lot there that we have tried to explain, and I stand for questions if there are any.
Okay, any questions of Mr. Reed? Okay, thank you for being here today. Okay, good morning.
Good morning, Chairman Harshman and members of the committee. My name is Lugina Mendez Harper, and I am a pharmacist. I work with Prime Therapeutics, which is the PBM that's owned by Blue Cross Blue Shield of Wyoming in part, in addition to some other, several other health plans across the United States that are affiliated with Blue. I wanted to stand here. I have participated in this process for over 2 years in engaging with the pharmacists to understand what the issues are that Wyoming pharmacies are facing. Come to the table as a pharmacist, able to understand pharmacist to pharmacist. What are you saying? Help me, I can understand that. And have really led our efforts to, go back to the PBMs, my PBM specifically, as well as working with the other PBMs to say, okay, this is what the pharmacists are saying is a problem and is a priority that they want us to work toward fixing. We would go back to our companies and talk to the subject matter experts, in various areas to say, here's what I'm hearing. Can you validate? Is this happening? How can we fix it? How can we make it better? And so that's really what we engaged in during the interim after the Corporations Committee asked us to have stakeholder meetings. They were moderated by Commissioner Rude so that we had folks that, could speak the same language and understand and really kind of dig in, because as Commissioner Rude said, it's really complex and hard to understand, even for those of us that, this is our lively, this is where we work and breathe and live. So I just wanted to share that that was the approach that we took, was really trying to be solutions oriented for Wyoming specifically. And we did come up with language that represented a consensus of agreement between us as well as the pharmacists. It didn't oppose transparency. In fact, there were many provisions in there that increased transparency, because again, our goal was, can we have language that gives the pharmacies a little bit of predictability in their interactions with PBMs to address some of the problems that they were sharing with us. So I want to correct the misinterpretation that we're against transparency. We are not. It's just the right transparency to the right entities. And that is what we work toward. So the bill that you have before you is nowhere near the consensus language that we agreed on. The consensus language we agreed on addressed transparency, addressed Wyoming specific problems, but didn't have any increased healthcare costs associated with it. That's not the case for this bill that's in front of you. So I want to just make certain that it's very clear that that you have a clear understanding that this is not, the bill before you does not represent what all of the hours and hours of work that we did over the interim. I do want to take the time, if I can, I know with my little gray hair, I can share with you that, I grew up listening to Paul Harvey and always liked his, here's the rest of the story. And so I want to just take a couple of minutes to just talk about one big major issue that the pharmacists stakeholders have shared with us. And that's, we need this bill to save our rural independent pharmacies. And we are simply asking to be paid or reimbursed what we pay for the drug. It sounds reasonable. But there's the rest of the story is that, this bill doesn't do anything specifically for rural independent pharmacies. It's much broader than that. When we went to the table over the interim and said, can we, do we want to focus on legislation that will specifically targeted for rural independent pharmacies? The answer was no, we want something broader than that. The claim about, I want to just be reimbursed what I pay for the medicine. Again, sounds reasonable, but in actuality, what it does in this particular bill, pharmacists pay for their medications and they have an invoice. And then after that invoice, there are rebates and discounts that they get from manufacturers and wholesalers. This language in this bill specifically cuts accountability and transparency of that transaction. Additionally, when you pay someone the cost that they pay, here's what it actually does. It decreases, there's no incentive for pharmacies to shop around for the best deal for that drug, or the best price for that drug. And the really key important thing that is the rest of the story that's not getting shared broadly is that it's about 10% of claims that the pharmacists themselves have testified that they're losing, that they're under reimbursed on. But what they're not sharing is that they have contracts with their wholesalers and they have to purchase 95% of their drugs from that particular wholesaler. That wholesaler may not have the best price, but they are limited in their ability to go out and go to a different wholesaler to get the drug that's available at a better price. So again, it's very nuanced. It's very hard to understand. And when you hear something on its face, you're like, well, that makes sense. But again, we want to make sure that there's a clear understanding of that. So again, I know I'm speaking longer than I should, but as a PBM expert, as a pharmacist, I just want to convey to you that we've really engaged actively with the pharmacy stakeholders. We felt that we negotiated in good faith over the interim, came up with language that really addressed the issues that they said were important, but didn't increase healthcare costs. This bill before you is not that. And so we stand respectfully in opposition and ask that you not pass it.
Thank you, Chairman Harshman. My question would be how the PMNs, what I understand, are total middlemen, correct?
We are part of the drug supply chain, just like pharmacies, wholesalers. Oh, I apologize. Chairman Harshman.
Thank you. And I have another follow-up with that. Okay. And if that's it, I'm just curious how the middlemen were able to buy some insurance companies, if they're just there to be the go-between the insurance companies to the pharmacist is what my understanding is. Is that
Chairman Harshman and Representative Strzok? Correct me. I will have to defer to my colleague, Michelle, who represents the entire industry. I am not one of the PBMs that has purchased an insurer. We are owned by insurers. We are the opposite of that. So I'm not really able to speak to that. So I will ask her to help answer that question for you. Thank you.
Good morning, Chairman Harshman and committee members. My name is Michelle Mack, and I'm a senior director at the Pharmaceutical Care Management Association, MACK. And I apologize for my voice. I don't know what's going on, but I'm losing it. I'll be really quick. PCMA, the Pharmaceutical Care Management Association, is the National Trade Association for the Pharmacy Benefit Managers. And I'm here to testify in opposition to Senate File 151. I don't want to duplicate anything, and I want to be very quick. I just wanted to bring up just a couple items. The bill would prohibit spread pricing, which I think you have talked about. And PBMs offer our clients that ability and our clients choose that. That is something that they get to choose. And each employer and plan sponsor evaluates and determines the financial arrangement that meets their specific needs. There's also been a lot of negative comments about PBMs, and just so that you know, PBMs save payers and patients 40 to 50% on their annual drug and related medical costs. And in fact, we save payers and patients an average of $1,000 per year per patient. At the end of the day, no one is required to use a PBM, but we are used. People contract with us to bring down drug costs, and we have done that, and that's why they hire us. One final thing that I did want to address is there is I think a document that talks about NCPA, which is the National Community Pharmacy Association, that talks about there hasn't been an increase in other states. A lot of that is because those bills were enacted maybe a year or 2 years ago. And really, in order for you to see if it actually has increased costs, something has to be in effect for at least 3 years. So we have not had enough time. A lot of those bills haven't been even implemented to date. So they are just starting. So with that, I thank you for your time and consideration, and I will be here for any questions.
Questions for Ms. Mack, Representative Swanitz.
Real quick, this handout's from you.
Correct.
Thanks.
Okay. Any other questions, Ms. Mack? Hey, thank you for being here today. Okay, next, go ahead, Mr.
Good morning, Mr. Chairman, members of the committee. I'm Jeremiah Reeman here on behalf of the Wyoming County Commissioners Association. We're certainly supportive and interested in ensuring that there is success on Wyoming's Main Street and that our small independent pharmacies share in that success. It's our belief that Senate File 151 is not that solution. Instead, it primarily helps corporate chain pharmacies. I've asked our counties to give me as much data as they can from their pharmacy benefit managers so that we can convey that to you. And I'll just share a couple of them. Fremont County, 63% of the prescriptions would be filled by chain pharmacies. In Sheridan County, that's 54%. This bill also adds costs. I'll share 4 county stories. Fremont County believes that it is going to add about $170 per employee per month, or $421,000 per year. Sheridan County, $97 per employee per month, for a total of about $169,000. Johnson County, $120 per month, per employee per month, for $112,000. Those are not insignificant numbers for those communities. We also received some information from Campbell County, and their human resources director states that year to date, they've already had over $6 million in claims, with over 900,000 of that being in prescriptions. They believe that the prescription number for them could potentially jump to $2 million annually under this new bill. With that, we stand in opposition to this legislation. We would ask that if you're going to move something forward, you would go back towards the compromise that was reached this summer, and let us continue to work. Let the parties continue to work on the other elements that are a part of this equation. And with that, Mr. Chairman, I would stand for any questions.
Hey, any questions for Mr. Reeman? Okay, very good. Thank you for being here. Who was next? Okay, go ahead, Mr.
Good morning, Mr. Chairman, members of the committee. My name is Bruce Spencer, S-P-E-N-C-E-R. I represent the Mountain Health Co-op, which is a relatively new health insurance company in Wyoming. Mountain Health Co-op has been writing insurance in Wyoming for about 3 years, and it's always a pleasure to return to Wyoming. It's where my wife grew up, so it's nice to be back here. So Montana Health Co-op has about 17,000 members in Wyoming, 24,000 in Montana. And I tell you this because the Wyoming premium revenue is about the same as Montana's. It is expensive to write insurance in this state for various reasons, but this bill does nothing to lower that expense. It only increases that expense. The bill says that PBMs cannot charge fees. Well, those fees are to pharmacists. Those fees are going to get passed on to health plans and the 17,000 Wyoming members. The bill says that there must be a retail pharmacy and network. Well, that's great, except there are certain drugs where health plans get a much better price through a mail order pharmacy. So what that says is we want you to pay more in Wyoming instead of getting a better price through the mail order pharmacy drugs. This is particularly true for specialty drugs. And I know you have a definition of specialty in the bill. It is extremely narrow, and it is going to raise costs for health plans not to be able to use mail order pharmacies for specialty drugs. And finally, that ability to appeal for brand name pricing. It's an established program. It's called MAC pricing. It's used for generic drugs. Everybody uses it nationwide to appeal your drug pricing. Because what PBMs do is they go around and they say, well, what's the lowest price you can get your drug from a wholesaler? And that's the price that certainly I, as an insurer with members, want my members to pay, is the lowest price. But the PBMs have entered into contracts, perhaps bad ones, with wholesalers, and they have a problem. Finally, I was part of the working group, and I appreciate the work, and I would encourage you to look at the Business Coalition letter. My small health company is not the only person that is opposing this bill.
Okay, any questions? Thank you for being here, Mr. Spencer. Any questions? I know it's, it's tough. I mean, especially we got a hard deadline. at
I
10
get it,
o'clock.
Mr. Chairman, and I understand the weather
Now,
just
you
like
two
you folks
guys
do.
are here. So any questions for Mr. Spencer? Okay, now I'm gonna give you a minute each. I think that's a
right.
minute.
Mr.
Go ahead.
Chairman, members of the committee, my name is Kelly Little. I'm with the Wyoming Association of Conservation Districts. I'm just wanted to include our data. We've been informed, we facilitate a health insurance pool for the districts in the state through the association. We've been informed by our provider that the financial impact could be $104 per employee per month. We've already seen from 2020 to 2022, a 20% increase in our premiums. And not sure what that will look like in 2023, but this bill is definitely a concern and we are opposed to it.
Okay, any questions? Ms. Little. Okay, thank you for being here. Go ahead.
There we go. Mr. Chairman, committee members, Devin Brubaker, Airport Director, Southwest Wyoming Regional Airport. Speaking before you for the Wyoming Airports Coalition and our 40 public use airports around the state. We stand opposed to any legislation that will continue to increase healthcare costs for our members. We struggle already with cost escalations, as we all know, in every facet of our business. We cannot sustain additional costs caused by legislation. So we respectfully ask for your opposition to this bill. Thank you.
Okay, any questions, Mr. Brubaker? Okay, you're the last one, so you're going to wrap it up.
Mr. Chairman, I'm Bob McLaurin, representing WAM, 98 of the state's 99 cities. I also represent JPIC Insurance Pool. It represents 67 communities and approximately 1,500 members. For the reasons stated previously, we are in opposition to this bill. Thank you.
Okay, any questions, Ms. McLaren? Okay, thank you for being here. We're going to switch now to those who are in favor of the bill. We'll put the 20-minute clock going again. So go ahead and fill the seats. Folks here that are in favor of the bill. And go ahead. You didn't say a word. You sat there, but you didn't say a word. Introduce yourself.
Hi,
You're here.
Scott Schmidt with Wyoming Pharmacy Association, and also I own North Star Pharmacy and Infusion here in Cheyenne. Thank you, Mr. Chairman, members of the committee. The reason why I didn't say anything prior to is I was waiting for what I could talk back to. So I made several notes. Heard a lot of words, heard a lot of things called with the word believe. We believe it's going to be $104 per person. We believe it's going to be this. We believe it's going to be that. There's no real number of where we're coming up with this. We believe 104. I can tell you as a small business owner, and it's not because I believe, it's because I can tell you. From 2021, we were under reimbursed $236,000 just to my pharmacy. Okay, that's on the private side. Year 2022 increased that number to $313,000 being under reimbursed And for me as a small business owner, I can't even compete with McDonald's when they're saying, hey, I can flip a hamburger for $18, but I can't tell my technician who can kill somebody if they're not paying attention to what they're doing, you're worth $13. So I have a hard time when I hear numbers from insurance companies saying we cover 125 lives, another 85 maybe out of state, 37,000 with the state employee insurance group, 17,000 with Intermountain Co-op. We have 125 pharmacies throughout the state of Wyoming. Those 125 pharmacies, of those 44, because we've just lost 2 more independents because of the struggle. So 123 pharmacies throughout the state of Wyoming touch 546,000 lives. That's everybody, whether they have insurance or they don't. And when they walk through the door, 9 times out of 10, we're losing money on their prescription. But we're not going to let them go out the door without having something in hand so that something major doesn't happen. And we can't do that very long. We can do that every now and again, but we can't do it very long and very often. To the healthcare spend on the state side, I have a hard time. As a Wyoming boy growing up in Cheyenne, attended the University of Wyoming, I bleed brown and gold. And when I look at $50 million of pharmacy spend from our state plan, and 90% of that leaves the state of Wyoming, and 10.8 leaves or stays here in Wyoming. Now put that into perspective. When they talk about price spreading, when you look at this mail order, US Biopharma Services, CVS owns that company. They dispensed 3,193 prescriptions for the year and generated $16 million in revenue. Now, Scott Schmidt's pharmacy here in Cheyenne dispensed 104,000 prescriptions and generated $8.5 million in revenue. It's tough to compete. Tough to compete when you have those kind of numbers. Now, when you look at the fact that these PBMs own 76% of the population of the United States, and they're talking about we don't want government power. These guys got more power than the government. At $780 billion in revenue, we don't stand a chance. And so, yeah, of course, they can go price fix. They can go purchase their drugs from whoever they want and say, you give us this price or else. I mean, we saw that last year. In January 1st, 2021, Bristol Myers Squibb didn't come up with their $200 million up front. And so their Eliquis got kicked off the formulary. So I'd like to know during that 6-month period, how many patients had a hospital visit because of a drug adverse event. But it was interesting enough, come July 1, Eliquis was back on the formulary. Now that should make us all pause to think that if they're willing to play those kind of games with people's lives, it's a serious issue and it's a big issue. And I'm frustrated, I'm ticked because I have everything right here to be as transparent can be. But I can't get that back from them. It's either you take it or you leave it. And that's not right. And that's not right. So I'm asking you guys, as Wyomingites, and proud Wyomingites is 307, as we always talk about, keep business local. If we lose these pharmacies in our communities, not only is it business and revenue for the communities, but they're educated individuals. And they're highly educated. And sometimes that might be the only healthcare provider they have in that community. And we know of a pharmacy that purchased the grocery store because it was going out of business during COVID, because they didn't want their community to have to drive 70 miles to go get a gallon of milk. This is a real serious issue. And if we keep playing it this way and we keep hearing these I believes or these hypotheticals, or it's going to be this, it's going to be that, we're just kicking, we don't have time to kick the can down the road anymore. So I'm asking you guys, as a local business owner, as a Wyomingite, as people that have 20 employees on my side that work for me every day, to help keep our doors open and hold these guys accountable, just as I'm accountable and as I'm as transparent as I have to be. And I thank you for your time. And I'll stand for questions.
Mr. Schmidt, Representative Oakley has a question.
Thank you, Mr. Chairman. So I've got a couple, hopefully quick questions. Do you agree with the number that it's about 10% of claims that you're under reimbursed for? Do you believe that's accurate?
No.
Go ahead.
Mr. Chairman. Mr. Chairman Harshman, Representative Oakley, no. I lose prescription. I lose money on probably 30 to 40% of my prescriptions every day. And the thing is, if you lose on a branded drug, you're going to lose some high dollars. But on generics, we lose on generics as well. So it takes a lot of $2 fills to make up for one branded drug that you lose $400 or $500 on.
Okay, Representative, she has a follow-up.
Okay.
Thank you, Mr. Chairman. So I don't want to get in the weeds here, but what's your take on the bill that we're hearing had some more collaboration and negotiation and then isn't what's in front of us? What what do you think about a return to sort of a more negotiated position?
No, I just, so I'm clear on that. There was reference to an agreement that everybody was at the table. I think that's what you're talking about. Okay.
Mr. Chairman, Representative Oakley, we were only allowed a certain number of people at the table at that time, and I was not part of that interim discussion.
Okay. Further questions, Mr. Schmidt? Okay, appreciate your testimony this morning.
Thank you.
Okay, Ms. Carroll.
Mr. Chairman, committee members, again, Melinda Carroll with the Wyoming Pharmacy Association. The first thing I would like to do is address the question. So Chairman Harshman, Representative Oakley, the agreed upon language that we had truly just reworked current statute that we had language changes in it that people agreed on, did it, and it added some certainty for us. However, when we came to that table, we had 3 issues that we wanted to address as pharmacy. The first 2, one was under reimbursement. The other one was freedom of choice for pharmacies. The third one was transparency in the current language. That third one is the only one that was addressed in that language. And because of that, we did agree upon the language and we're still fine with that language. However, when that was brought back to the pharmacists, business owners, so on and so forth, they felt misled that it did not address their top 2 concerns. And so Senate File 151 is what addresses their top 2 concerns. Had that language been ran, we would have been fine with it and we would have, spoken support of that. However, we were not going to say that this was a bill that was consensus truly, because it wasn't. With that, I would like to provide my testimony.
Sure.
Unless there's a follow-up question.
Go ahead.
Wyoming citizens have come to our government to ask our elected officials to bring back balance to an industry that has a large disparity in contracting power, which could be described monopolistic at best. This is a basic function of the government in the free market, which one could argue that this has ventured very far from what a free market is. The practices of PBMs are continually brought into question due to lack of transparency, conflicts of interest, and for anti-competitive behavior. The need for greater regulation and transparency in the PBM industry has been highlighted by many, including the Federal Trade Commission, who is currently investigating PBM practices. We need to ensure that PBMs are acting in the best interest of patients and consumers. Senate File 151 is a step in this direction. There has been a lot to say what this bill does, but what this bill does is require drug pricing transparency on all medications. It allows pharmacies to appeal, yes, just appeal, and to the people that are telling them that they're going to pay them less. Underpayments on all medications, not just generic medications, which is not where pharmacies are losing hundreds of thousands of dollars, as we have heard. This bill also greatly increases transparency in those appeals, requiring PBMs to report which wholesaler the medication is available on the date of dispensing at the reimbursement rate which it was paid. If PBMs fail to meet these standards, pharmacies can submit a complaint to the Department of Insurance, which will then complete an investigation into the underpayment. This is not a guarantee of profit for the pharmacy, which we have heard is an argument today. That doesn't mean that pharmacies will get paid that. They can still be denied that. So the increase in cost is, again, questionable. This bill also requires a community pharmacy to be included in network, eliminating PBM's requirement to use only a mail order pharmacy that the PBM owns. This allows patients to choose the pharmacy that best meets their needs, whether based on location, hours of operation, services offered, or the type of medication that they need. This is especially important for individuals who live in rural areas like most of Wyoming. For example, those who have mobility issues, live in weather-sensitive areas, or have a relationship with a community pharmacist, as it allows them to access pharmacy services without traveling long distances, sacrificing healthcare relationships, or not knowing if their drug is even viable to use. Also, as you all are aware of, pharmacists did agree to exempt specialty medications. Community pharmacies can generally not afford to carry these medications. But as an insurance to the health plans, pharmacies wanted to know that that language was exempted in the bill. Industry representatives have called this a Caddyshack bill and a Christmas tree bill, trying to divert attention from the practices that are actually happening. This is a complex topic, and many that do not know the inner workings of this unregulated industry have spoken out against this particular legislation. I would challenge each and every one of them and each and every one of you to visit any pharmacy to see what incredibly unbalanced market forces they have to deal with on a daily basis. As an example, my pharmacy, which is a grocery store pharmacy, often mistakenly called a chain pharmacy, they are not the same, had $9.1 million in gross sales last year. Our net profit on those sales, $56,000. That's a net profit percent of 0.0062. My company will continue to provide services because it builds brand loyalty. But even this will eventually end if nothing changes. Not revamping regulations on this industry is a recipe for disaster. We have lost 2 locally owned independent pharmacies in the last 6 months. And I hate to break it to the committee, if nothing happens this year and we kick the can down the road, as was stated, 2024 is going to be brutal for healthcare in Wyoming. There are unique circumstances that will lead to closure of far more pharmacies in the state, limiting access to care and decreasing health outcomes, no matter what the billion-dollar companies that are based in other states say they can provide to our citizens. We are asking our elected officials to be statesmen, not politicians. Be brave enough to question the information fed to you by those with money and power that can help you win your next election. Look at correcting the market imbalance that has occurred where the golden rule, which one summarized by an industry insider quite well, whoever has the gold gets to make the rules, has reigned supreme for the last 20 years. Without addressing this issue, Wyoming citizens, businesses, and frankly, the viability of certain communities will be put at stake. This is a very serious matter and needs to be debated and heard on a greater level. Please do not discount the voice of hundreds and hundreds of your constituents that I know have reached out to you for the voices of a few industry insiders and lobbyists. With that, I will stand for questions.
Okay, questions, Ms. Carroll? Representative Bear?
Thank you, Mr. Chairman. Ms. Carroll, I appreciate your comments regarding the free market and monopolies. And that is my concern when I look at the practices that are currently happening. And as I look at historically, we have centralized control in the medical industry over and over and over, and costs do not go down. They continue to rise. One of the pharmacies that is recently shutting down is one in my community. I've spoken to the owner. It's pretty clear that this practice is contributing greatly to their demise. My question to you is specifically on this appeals process, which seems like a pretty reasonable thing to look at. It seems that the bill only prescribes that a system be put in place, doesn't prescribe how it should happen. And then you mentioned that there's also an opportunity for the insurance commission to settle disputes. In your opinion, will this help save pharmacies in our communities?
Chairman Harshman, Representative Bear. This will hopefully be a stopgap to that bleeding of money for those pharmacies. The hope of the appeals process is if enough appeals are made and they're seeing that they're underpaying on particular medications over and over and over again, they will reconsider their payment structure to those pharmacies, especially if those complaints do get made that they are not following through with how they should respond to those appeals. Again, an appeals process we don't feel is going to be this catastrophic loss of money for these companies or catastrophic increases in prices, which I would question why the prices are increasing to the health plans and the patients and everybody but the prescription benefit manager. That's an interesting idea that I just would like to ponder. However, I do think that it will help pharmacies stay open in the state. Is it the final answer? No, I do not believe it is. I do believe there needs to be further work done.
Maybe just a question on process. So you agree we spent an interim and everybody came to the table, I'm not sure enough of everyone. I guess my ultimate question is, why didn't we start from a bill that was agreed upon and then the association could come and bring amendments to that bill? Why say no to that bill and then go to other legislators and say, we want to ram this through the process? And in my mind, disrespect all the work that was done. I agree it wasn't completely fair to the pharmacists, and we're all trying to find this balance here. But I guess my question is, why didn't we at least start from a floor we all agreed on that moved the ball down the field a couple of steps, and then we tried to move it down a couple more because I would have been a lot more agreeable. I'm still going to try to find ways to move this forward, but what was the thinking there that we scrapped that and tried this full court press again?
Chairman Harshman, Representative Zwanitzer, thank you for that question. That comes down to, again, the membership feeling misled and mistreated, quite frankly, by the industry. At the first meeting, I was the only pharmacist.
Yeah. Chairman Harshman, thank you. And to Representative Zwanitzer, into that question as well, as I think when we got to that point in the interim, I think we felt like we've peeled back the onion as far as we could have really gone. I mean, we went from a 26-page bill down to an 11 or 12-page bill, and we conceded and consented on everything. And they came back with nothing And that's where lies the frustration.
Folks, and so we're gonna move and we gotta work this bill. It is 9:37. And so we're gonna close public comment. Appreciate everybody being here today. And appreciate your comments. Okay, we're on Senate File 151. Members, what's your pleasure? Move the bill by Representative Strauch. Seconded by Representative Block. Okay. Members, let's work the bill. Representative Swanson.
Just a quick comment, because I know we've talked about the substitute bill, and if there is any misconception, the substitute bill before you is what originally was the legislation that was worked on in the interim that Senator Baldwin and I were going to bring before apparently the compromise fell apart. So there's nothing in that substitute bill, if you even want to call it that. I do believe you could amend this in, and there's a little bit of overlap. But I am optimistic that there's portions of 151 in this blue form that we can keep and kind of get a grand, not compromise, but get 60% where we can all agree on. So I just wanted to address, I know there are some concerns with this other substitute bill. This was the compromise language, and I do think it can be amended in at the appropriate time the committee wants to, Mr. Chairman. Thank you.
Okay. I think you get, do we have a copy of that?
Yeah, I think it's passed out.
Yeah. Got it somewhere here. Okay, let's start working the bill. Page 1, of course, is the title. Let's move over to page 2. Okay, move. Page 3. Okay.
Wait for page 4.
Page 4.
Yeah.
Go ahead, Representative Swanson, as amendment.
And so, Mr. Chairman, I'm going to try to be simple and easy and explain as much as I can here. So my motion is going to be to delete all of page 4. And you'll see on the transparency sections in 2652-105 on pages 2 and 3. When I've checked with everyone, I think we can all agree we do need a process that encourages transparency and fraudulent claims to be audited and have that compliance we've actually already had in our statute since 2017. Once we actually get to page 4 and start there with Romanet 4, these are where we start talking about concepts that are, well, let me just say they're unagreed upon. And so what I'm ultimately, I think, hoping for committee is to get to a place where we can get a bill out of this committee, and then we can maybe have substantive policy related discussions on the floor that we don't have time for today. But I think everybody would agree to page 2 and 3. When we talk about 4, these are alternate ways that we talk about way back on page 2. The pharmacy benefit manager agent shall not. And so some of these definitions, we talk about spread pricing or network providers or how they retain funds, and 6 is certainly problematic. And so for the health of the bill, at least for my vote, I'd like to remove all of page 4 if we're doing a page by page basis. And that would go through the top of line 2 on page 5.
So those Romanets 4, 5, 6, and 7.
Correct.
Okay, is there a second? Seconded by Representative Oakley. Any further discussion? Okay, all those in favor of the amendment, say aye.
Aye.
Opposed?
No.
Okay, I don't think that amendment's been adopted.
Division.
Okay, all those in favor of the amendment, raise your hand. 1, 2, 3, 4. All those opposed? 1, 2, 3. That amendment has not been adopted. Okay. Next page,
Yep.
page 4, page 5.
Page 5, delete, it'd be Romanets 9, it'd be everything line 11 down. I'm perfectly fine with Romanet 7, lines 4 through 9. On sharing that information with the insurance commissioner or law enforcement. But the amendment would be to delete Romanet 9 and then the network provider language up through page 6, line 5. It talks about specialty. And if you're not, there's some real difficulties on page 3, line 3 that weren't discussed today, but there's a difference when we talk about generic drugs and specialty drugs and how you acquire those and how you price those and how long you can keep those. And this, I think, is the crux of the argument that's really worrying industry and the price escalation aspect. And so anything that deals with specialty medications, I get that's a pretty large fight. So my amendment would be to delete lines 11 on page 5 through page 6, line 5.
Okay, is there a second? Okay, it's been seconded by Representative Oakley. Further discussion? Yeah, let's just, Representative Bear.
I just have a question for the bringer of the amendment. Now I see it on the last line, page 6, line 3, specialty medication. So are these other paragraphs really addressing the specialty medication issue? And one thing that was brought up by testimony amongst those who were opposed to the bill about the narrowness of the definition of a specialty medication. So are we addressing that?
Representative Swanson.
Mr. Chairman, Representative, I think we're trying to address that throughout the bill. I think specifically on Romanet's 9, you're basically price fixing when you're saying you're reimbursing a pharmacy for their services, but not less than the amount. The PBM affiliated pharmacy providing the same services. You get other things into play. So when we talk about these as middlemen, but think about, it's just an economy of scale issue. When you have larger companies that can get drugs cheaper and supply and demand and logistics chains, it's just really difficult to say that everything's treated the same when you get all sorts of rebates. And that's how these PBMs work. And they're popular because, they, in very, very simplistic terms, they can buy in bulk, they can give rebates, you can do weird things called clawbacks. And that's the difficulty when you're trying to kind of price fix across the field and say everybody's equal. You're taking out that it's competition in the marketplace, even if it's unfair, I can admit that in some places, but ultimately the bill, I grew up in a family that had 8 furniture stores, and my childhood was having one of them go out of business every year for 6 years straight because of, we'll just call it the Walmart effect, right? You have somebody can do it better in a corporation and it hurts small businesses, and it's not fair and it's not right, but that's how the free market works. And so on some of these things, I feel for independent pharmacists, just like everyone else does. You can't pass that cost on to everybody else to send money to a couple individuals. And that's, I think, what really bothers me with the bill and why I'm trying to get it to where it's not contentious, but we get it down the field a couple more steps for this year. So I hope that didn't necessarily answer the question, especially the medication, but I know we're running out of time. But just know that generic drugs are treated much differently than specific, what we call specialty meds that are higher priced, very targeted to certain populations, really tough for an independent pharmacy in a rural area. If you don't have one of these patients or someone who needs that drug, right? It's a lot. I'll stop now, Mr. Chairman, but I just don't want to think I'm trying to hurt the bill. I'm trying to get what I think is agreeable to the field for more discussion.
Okay. Another question, Representative Bear.
Thank you, Mr. Chairman. And just to follow up to the bringer of the amendment, as I look at page 5, lines 11 through 14, this is prescribing a fair practice, basically saying that when there is a monopoly situation, that monopoly cannot be used to the benefit of the monopoly. So I'd hate to see this removed. I do understand the concern about specialty drugs, but we're trying to deal with a monopoly situation here.
Real quick.
Okay, go ahead.
Yeah. So, Mr. Chairman, these are the thou shall not sections that a PBM can't. Back on page 2, an A, the pharmacy benefit manager, the agent of the PBM shall not. And that's why I have difficulty with this language. You have to basically reimburse everyone the same, but there's you get rebates and you get other things at play. And so that's my concern with this part of the language.
Okay, further discussion, questions? Okay, all those and I'll just restate the amendment is page 5, lines 11 through top of page 6, line 1 through 4 on page 6. Is that correct? Just make sure we're
And that's
Okay.
to completely delete.
completely delete. Yeah. Okay, all those in favor of the motion, please say aye. Opposed?
No.
Okay, I think that amendment, all those in favor, raise your hand. Let's do it that way. 4, 5, so that amendment has passed.
We have an amendment.
Okay, amendment by Representative Oakley.
Thank you, Mr. Chair. Going back to page 4, the amendment is to delete lines, the entire page, lines 1 through 22, top of page 5, lines 1 and 2.
We just had that amendment, didn't we?
We did.
I brought it. Change your mind yet?
Well, let's keep moving. I'll come back to that in a minute. Let's keep working. Okay, we're on page 6. Okay, Representative Schwanitzer.
So Mr. Chairman, it would be a delete starting on line 16 after the word disputes all the way through line 20. And so this still would allow in lines 12 through 15 to certainly have that process to investigate and resolve disputes. But when you're allowing the appeal, all of those words are very charged and mean things, and it's just one more step, I think, too far than we want to go. And so I'm certainly fine with appeals and resolving disputes. When you start putting things in statute that you can look at each one of these things, you would be appealing perpetually, and that concerns me. So I think it's better to have the language out. Would ask for your.
So just,
Resolve.
it's after disputes, put a period,
Mhm.
and delete and allow, and then all of 17 through 20.
Correct.
Okay, is there a second? Okay, by Representative Oakley. Further discussion? Okay, all those in favor of the amendment, say aye.
Aye.
Oppose?
No.
I think that's been adopted. Okay, page 6 over to page 7. Representative Swanser?
If I could have a little latitude, Mr. Chairman, to express my concerns and just tell you, I don't know how to fix it. So when we're changing the definition of MAC, the maximum allowable cost, and we're now saying that it includes reimbursement for drug based on any of these following categories on page 7 up through line 6 on page 8. You're basically allowing 6, maybe 7 if you count G, different. So you have a drug in the marketplace and you're pricing it based on any number of things, right, through these supply chains, and you're looking at all of these. And once you allow them all to be based on any one of the following, when we go back to these appeals, all of a sudden you can say, well, maybe the average manufacturer price was fair, but actually we found that if you look at discount indexing and some other pharmacy in another state has done this, you know, we feel we got infringed upon and we can appeal on that. And so in my perfect world, I'd love to pick one of these 7 and just say, this is the way Wyoming is going to, you know, set that floor, that standard, but allowing 6 different options and to be able, when we talk about MAC, then all of a sudden you're allowing, you know, an appeal or a contention on any of these. That's just way too broad. And I don't know how to pick one. And I don't know if anybody would feel comfortable right now picking just one. But I know I don't want to have 6 different options in statute, and that will create lots of contention. So I would ask you to take that out at this time, and if we can find a definition on the floor that incorporates this concept better, but right now it's just too broad.
Why don't you just leave it? We keep working on it. Fix it on the floor.
I don't know
Any
if I have
thoughts on that?
notes on the floor is my problem.
Okay,
I've got a
do
question.
you have a question, Representative Oakley?
Thank you, Mr. Chairman. So I know you've worked this a lot, Representative Zwanitzer. Is there anything, you know, through that experience that has addressed this in a different way?
Representative Swanser.
So, Mr. Chairman, I think you heard, and I don't want to say it's ornaments or Christmas tree decorating, but some of these come from other states that are in lawsuits when some of these definitions you're taking from other places. And they're saying, well, it's defined in Arkansas, I think is this one, or maybe New Jersey, I can't remember. So every state is in a different place with PBMs. And so, and some of what this bill does is just cut provisions from other states and throw them into Wyoming statute and saying, well, they haven't been sued yet, or they haven't had an increase in price yet in those states. And so we're going to just copy them without knowing the effect. So my honest answer is I don't know which one of these ways to go. I would almost hate to put money in, bet money on the insurance commission trying to pick which one of these he thinks would be the best. I just think right now we don't know what the industry standard is, and allowing any of these is too broad.
Okay, is that? Okay, Representative Straw.
Thank you, Chairman Harshman. I guess my question is, do we have anything left in here to protect our pharmacies when we get through? That's what I'm feeling like is there anything left in
Okay,
here?
but let's
that we're
get
gonna
back on
protect?
the amendment here on this bill here. Okay, so is there a motion? Did you make a motion?
Delete it all, Mr. Chairman.
So the motion is,
All would be all new language from lines 11 through
so you'd leave.
10 on page
You'd
8.
leave generic drug in place. You can get rid of
Yeah.
that cross out.
Yeah,
Leave the current language through line 9 on page 8.
correct.
Okay,
Just quick.
is there a second?
I'll second.
Second for discussion. Okay, Representative Oakley.
Thank you, Mr. Chairman and Mr. Chairman and Representative Swanster. So you're saying if we delete this, then it just reverts to what's currently in statute. So it's, again, it's. Okay.
That is
Okay.
correct, Mr. Chairman.
All right. Okay, further discussion on that? Okay, all those in favor of the motion, please say aye.
Aye.
Opposed?
No.
Okay, chairs in doubt, all those in favor, raise your hand. 1, 2, 3, 4, 5. Okay, that motion is passed. Okay. We're back on page 8. Okay, Representative Swanser.
So, Mr. Chairman, page 8 on that Romanet 7, I do believe the department wants to take the language originally on page 10, when it said that health benefit plan, not including Medicaid, Medicare, other health maintained by the federal government. And so LSO would have to draft that language
Take it out of the spread pricing on Romanet 12.
and insert it into Romanet 7, as well that workers' comp amendment should
So-
also go in that PBM definition.
And that one has been distributed, I think, by the sponsor on the workers' comp. And so those would go under Romanet 7. Are you good with that, Ms. Jeffrey? It's taken that language. Go ahead, Representative Swanser. That was testimony on top of page 10. It's in currently in line.
It's a little
12.
rough, Mr. Chairman, but it's basically lines 3 through line 6 on page 10. And it would have to be wordsmith into that definition correctly, which I know LSO could do. And I guess my emotion was also to put the workers' comp language there and
Put
that.
those two things in Romanet 7. They might do an A and a B with that. Yeah, that's part of the amendment. Work, and then taking the Medicare, Medicaid and the federal programs out from under spread pricing in Romanet 12. Okay, is there a second? Okay, it's been seconded. Any further discussion? Okay, all those in favor say aye.
Aye.
Opposed? That amendment's been adopted. Okay, page 8, bottom of page 8, moving over to page 9. Okay, Representative Swanser.
Thanks. I would move to delete everything line 11 through line 10 on page 10. This was the extra amendment, I think, on the our good friends down the hall put on when it talks about specialty medications. And that's just a sensitive subject. And I guess it might not be nice to have a definition. So let me make two different motions, Mr. Chairman. The first would be line on page 9, delete everything's lines 11 through 22. That just deals with defining specialty medications. I'm not going to follow my sword on that one. I just think it's better not to define it right now or come up with a definition that everybody can agree with at this time.
Okay, is there a second? Seconded by Representative Oakley. Further discussion? Okay, then again, the amendments 11 through 22 on page 9. Definite, that's Romanet 11, definition of specialty medication. Okay, all those in favor, please say aye.
Aye.
Opposed?
No.
Chairs in doubt, all those in favor, raise your hand. 1, 2, 3, 4, 5. Amendment is passed. Okay, now we're going over to page 10.
And Mr. Chairman, because we moved most of this language over, I would just delete lines 1 through 9 on the definition of spread pricing and take that definition out as well.
Is there a second? Seconded by Oakley. Okay, any further discussion? Okay, all those in favor say aye.
Aye.
Opposed?
No.
I think that is also passed. Okay, I'm on page 10 still. Okay, working over to page 11. Okay, page 12. Representative Wanitzer.
I'd like to delete the new language on line 6 when it says similarly situated pharmacies in the state. I just don't know what that means, and I haven't been given anyone to tell me if that means an independent versus a chain versus an insure. I don't quite understand how that definition reads or why it's needed. So I just moved to take it out at this time.
Is there a second? No second. Okay. Dies for lack of second. Okay, page 12, any other amendments? Okay, page 13. Okay, page 14. Representative Wanitzer.
Mr. Chairman, I'd just move on. It's on page 13 and 14. It's on line 12 on page 13 and line 2 on page 14 to put it back to general funds. So if I could have a little bit of leeway in explaining, right now, the Department of
Yeah, go ahead.
Insurance charges insurance companies to run their operation, right? They put an assessment basically on our insurers. And so if the state of Wyoming is saying this is important enough that it's, a public policy from the legislature, I do believe we should commit general funds to a position to studying this. It's my hope, this is probably the most important part of the bill. We need some more expertise in-house to be able to really investigate. And we probably need some outside contract funds to help get that person up to date. I just think it's not fair to charge insurance companies, and primarily it's one insurer in the state, this extra funding for something the legislature is pushing on the department.
Okay. Is there a second? Representative Oakley? Okay. Everybody understands that amendment? All those in favor of the amendment, please say aye.
Aye.
Oppose?
No.
Okay, that's been adopted. Okay, any other amendments? Representative Oakley?
Thank you, Mr. Chairman. Page 4, the entire page and the top 2 lines on page 5.
Okay, page 4. Say that again. please.
Delete the entire page 4, lines 1 through 22, and the top 2 lines of page 5, lines 1 and 2.
Okay. This amendment previously was considered and died on a tie vote. You can tell by my look on my face, I'm not real happy about that, but about this coming up again.
You
Okay,
should be proud of me.
yeah, okay, so everybody understand the motion?
Yep.
Question? Yeah, Representative Swanson.
And I just didn't mention it. It's on the top of page 5. We're talking about these contracts, and it's saying the PS, the pharmacy benefit manager or their agent. When we're talking about these copies of these contracts that they have with requesting pharmacies, I do think sometimes that's proprietary information, and that's really a constitutional provision that thou shalt not, force anybody to look at someone else's contract. I do understand for transparency, that's important, but I also, you have these agreements between companies and rebates, that is proprietary information.
Understand, we do have a few private trusts in the state. Okay, everybody understand, go ahead, Representative Norton.
As I was not here, can I hear more discussion on this portion of it being as it was a tie vote?
Go ahead, who wants to?
I will.
Go ahead, Representative Vaughn.
So real quick, Mr. Chairman, if you look back on page 2 on line 9, this is what a PBM or an agent shall not do. And we've left all of page 2 and 3 intact. And the really interesting stuff starts coming in. Well, So when we're saying they shall not on page 4, it just kind of clearly cuts there at Romanet 4. In the first Romanet 4, we're talking about specialty medications. And I think actually we deleted that definition now, so it probably needs to come out. We also deleted the spread pricing definition because we moved that language over into PBM definition. So it probably should come out now. And then the rest of that, we're talking about negotiations and contracts. And I think PBMs, as much as some people don't like them, they do serve a purpose. And for the people who utilize them, they find ways to save money, either through economies of scale or rebates. And love them or hate them, I think the drug companies sometimes are getting rich, but I don't think the PBMs are. And so trying to force them to disclose their contracts and some of their internal mechanisms on how they operate with these insurers, or even with your small independent, maybe not your small independent pharmacies, but you have these other PSAO organizations and others. I just don't think it's right or fair or constitutional to kind of force them through statute on preventing.
Okay, any other discussion? Representative Straw.
Thank you, Chairman Harshman. I think what really I learned a lot about this when I first got elected, and what bothers me the most, PMMs are not just, sorry, thank you. So they're not just hurting our small pharmacies. They are actually hurting even Safeway. And we're going to end up totally having to call or make it all be over the internet or calling, and it'll be mailed to us. If we don't calm them down and bring them back to some accountability. I still never got an answer to how someone that's a middleman is able to buy insurance companies. Was never answered that. So they're making money somewhere and they're not giving it back to our pharmacies. And it was not just our small town ones. And maybe Safeway you look at as a small town one, but they're getting hurt as much of Walgreens is getting hurt. It is not just, we're going to be totally mail in. And I don't know about you all, but when I go in and I have a child that's sick, and who do you talk to? You go to the pharmacy, you go to the pharmacist and you say, what could I do? And if they give you stuff that's even over the counter, but they talk you through it. We are going to miss that. And I think that's where it is. We're hurting ourselves. We're hurting the small town businesses. You're hurting our people in our small town. And you're hurting even Safeway. The only reason Safeway can keep it going, they sell food. And they're hoping when they keep that open, people will come in and buy other things, not just that. And our pharmacists in Douglas, one of them, they bring in gifts, for birthdays and to keep their store going. And that's how they're able to keep it going.
Sure.
And I think that's what's really bothering me. Do we have anything left in here to protect our pharmacies? And I don't mean just our small town. I mean, Walgreens, Safeway. I don't know. That's all I
Well,
would
let
like
me-
an answer to.
Let me get back,
Thank you.
and I appreciate your comments back on this amendment. And I'm just going to say we're closing the end of this bill. We're getting close to the end. But as you folks who are here know, it's not the end yet. And it'll have to go on committee of the whole, first, second reading, third reading, and then a conference committee between the two bodies. So everybody keep working, whatever your position is, as part of the deal. I was on the losing end of every vote today. So, but we got to keep working. So that's part of it. And that's how we make the best product. So anyway, we're back on this amendment. Okay, any other questions? Representative Bear?
Thank you,
Questions?
Mr. Chairman. This is on the amendment. The comment was made that we need to stay out of the business of these operators and not affect the things that are going to affect pricing for our constituents. But these amendments, and this one in particular as well, they're removing protections against monopolies, and governments do protect against monopolies on a regular basis. That's my comment.
Yeah, no question in that, but appreciate your comments. Okay, we're on this amendment. All those in favor, please say aye.
Aye.
Opposed?
No.
Okay, all those in favor, raise your hand. I think I know. 3, 1, 2, 3, 4. Okay, all those opposed, raise your hand. 1, 2, 3, 4, that amendment has failed. Okay. Okay, any other amendments on this bill? Okay, I think we ready for the question? Okay, question. I can sense we're ready for the question. Please call the roll on Senate file. You have a question?
Don't have a question. I have a comment.
Well, we're out of time for comments, so we're gonna have to save them for committee of the whole. Please call the roll on Senate File 151 as amended, and then we're not done yet. We're gonna take some public comment. We're gonna miss roll call for air. But we got one person that's driven today for the next bill. We're gonna take his public comment. Okay, go ahead. Please call the roll.
Representative Bear,
Aye.
Representative Byron,
Aye.
Representative Locke,
Aye.
Representative Northrup,
Aye.
Representative Oakley,
Aye.
Representative Storer,
Aye.
Representative Strack,
Aye.
Representative Zwanitzer.
Aye.
Chairman Harshman.
Aye. Okay,
That
thank you.
passes.
We'll keep working. Thank you for presentation today. And we're now gonna move
Can I have one moment, Mr. Chair?
like
Just
10
one
seconds, 10
moment.
seconds, go.
I have never seen anything like this in my life. And I've got to tell you, today is one day out of 13 years being involved with the legislature. I'm ashamed to be a
Oh, now,
legislator.
stop. You're done. Yeah, careful there. Called bicameralism. Okay, next bill. And boy, if I'd have known you're gonna take that little cheap shot, you wouldn't have had the mic. Shame. Okay, now we are on the next bill. Let me turn my mic on. Now, your bill, it's a short bill, it's easily understandable, and I want to take due time to hear it all, but we've got folks who have traveled here to give public testimony in person, and that's what I'm really concerned about. Is that okay? And then we'll just meet it. We'll start at 7:30 on Thursday with this bill, you presenting it. But I'd like to take that public testimony. Is that, Senator?
Thank you, Chairman Hartman, committee members. Talked to the person traveled down here to testify, and he's willing to wait until Thursday morning. It
Oh,
will
is
be
that right?
better if we do it that way. We can just do the whole thing, and if that's okay with you.
Absolutely. So I'm gonna have about 4 bills stacked up on Thursday. We're probably not gonna get to them all. But yours is gonna be first at 7:30, so we're
Okay.
definitely gonna knock that out and go to work on it. Okay, so appreciate you traveling here. Sorry for the inconvenience. That's why I put if time allows, because I just knew that last bill was gonna. In hindsight, I probably should have just scheduled the one bill, but hey, I'm always hopeful. Okay, thank you, Senator. Appreciate you being here. Thank you. And it's Farr, right? Mr. Farr, Josh, thank you for being here. We'll see you Thursday. Okay, we're adjourned.